Hello, everyone, and welcome to the Medical Society Consortium on Climate and Health Annual Conference. I'm Mona Sarfaty, a family physician with public health training and the director of the consortium. What a difference a year makes. We have gone through a year like no other in our history. The health of our patients and our communities are our highest priorities, and we have suffered through a year of heartbreaking losses and stress in our efforts to provide care to those with COVID-19. But with the development of vaccines and our success in getting shots in arms of now more than half of the adults in the United States, we are seeing light at the end of a very dark tunnel. Finally, we can look forward to a future with hope that we will beat this virus. We come together today to talk about another reason for health providers to feel hope and optimism: the growth and increasing traction of our movement to protect and advance health by addressing climate change. Here's what's making me so hopeful. First, we now have an executive branch fully committed to an aggressive all-of-government approach to climate solutions, and one that is signaling both domestically and to the international community that climate is one of its highest priorities. That's no accident. It's the result of an election in which climate change was a central issue and where the connection of climate change and health was made. That connection, in turn, was the result of your unprecedented level of work and engagement over the past 5 years. We have grown and galvanized a network of over 1,000 individual advocates at the federal, state, and local level, of 32 medical societies from an initial 7, and of 59 affiliated organizations, including 16 state-based health groups. In a nutshell, our initiative has become a full-fledged movement happening at every level, locally, nationally, and globally. And our work to reach people around the country has now opened doors at the federal level. Just let me give you a little bit of the history of this election cycle, in which our objective was to convince voters to elect policymakers who care about our health and our climate. Our 30 Health Voices for Climate Action videos reached over 153,000 people in electorally relevant states. You just saw a few of those videos. Our open letter to candidates advising them to talk about health whenever they talk about climate helped some candidates to more effectively frame their message. These tactics, along with the candidate questions, policy briefs, hundreds of op-eds, and other activities, all helped to make a difference in creating the new opportunity before us today. But what makes me even more hopeful is knowing that in the process of pursuing our objectives, we have also come together and grown together in ways I could never have imagined. We collaborated, we honed our message, we learned from each other. The Black Lives Matter and environmental justice movements have placed the idea that everyone has the right to live in a healthy environment at the center of our advocacy. Finally, I'm more hopeful than ever about our chance to seize the opportunities before us, because our trusted voices are delivering messages that have the essential ingredients for building political will to support the ambitious changes that science is telling us we need to make. From policymakers to the general public, people are listening when we say that climate is not a distant threat, but is already harming our health now. We are making solving climate change personally relevant. People are listening when we tell them that these health harms and associated costs, especially to the most vulnerable amongst us, will only grow, and could grow dramatically unless we take immediate and bold action to prepare and prevent the worst scenarios. We're making solving climate change a matter of urgency. And people will listen when we tell them about the ambitious solutions to climate change that will also deliver rapid improvements in our health, in equity, and in well-being. We're building confidence that these changes will be good. In fact, this will be the focus of our meeting this year. We call it the Health and Equity Promise of Climate Solutions. We know that the president says when he hears climate, he hears jobs. That's great because good, steady jobs are an important social determinant of health. But when we hear climate change, we hear health and equity. Why? Because the transformation of our energy production and use, including energy efficiency, can improve our health. Why? Because a shift in our transportation priorities and choices can get us moving and improve our health. Why do we hear health and equity? Because transforming our food systems can improve our health, get us cleaner air and cleaner water, and help the most vulnerable avoid hunger. Why? Because creating healthier indoor environments and greener, cleaner outdoor environments can also improve our health and well-being and can reduce environmental injustice. Finally, because strengthening our health system and reducing its carbon footprint can reduce the negative environmental burden of health delivery and create a resilient health system that will be there for everyone when they need it. Helping people understand the personal relevance of climate change, the urgent need to take action, and building their confidence in solutions are three essential building blocks of political will. And we are the trusted messengers who can deliver these messages. I guess it will be no surprise for you to hear that my hope and optimism is only tempered by the recognition that we have a lot of work to do to seize this moment of opportunity. We want to be front and center in every important climate discussion. We know we can count on you, and we encourage you to actively recruit your colleagues to this cause. We need them. Now I have quite a few people to thank, so please bear with me. In addition to thanking all of you and our speakers, I wish to thank our highly skilled, talented, hardworking, and totally committed consortium team who even now are busy working behind the scenes. Mohammed Ahmed, Wendy Cook, Ira Dreyfus, Rob Gould, Bev Harp, Kate Hoppy, Ed Maybach, Mark Mitchell, Colin Ackerman, Jerry Paulson, Linda Rudolph, and our interns Savannah Martinsik, Zarina Murillo, and Clarissa Payton. I also would like to thank our public relations team from Burness. I'd like to thank our steering committee who helped to shape key parts of this meeting and our board of advisors who are providing invaluable advice. I would also like to thank our generous sponsors, our lead sponsor, Johnson & Johnson, our gold sponsor, Walgreens, our silver sponsor, the MITRE Corporation, our bronze sponsor, the American Lung Association, our green level sponsors, the American Public Health Association, the American College of Physicians, and Climate for Health, and all of our contributing sponsors. You can see them on the slide. We have much in store for you at this conference, including stimulating presentations and opportunities to interact with your colleagues. I know that working together, we will get this important work done. This is our moment. We hope you enjoy the meeting.